Hello, everyone. Thank you for joining us today. We're going to be talking about positive parenting solutions during the COVID pandemic. My name is Dr. Noha Polak. I'm a pediatrician. I've been practicing in Union City and Bayonne, New Jersey at Progressive Pediatrics since the year 1996. And today I'm joined by Claire Smith.
Hi, guys. My name is Claire Smith. I'm a physician assistant and I work at Progressive Pediatrics. I've been here for about a year and a half, and I've been practicing pediatrics for 6 years.
All right. Thank you, Claire. So, Claire is our parenting expert mainly because she knows a lot about it because she has young children. You want to tell us about your kids, Claire?
Yeah, so I get to practice every day. I have a 4-year-old girl. Her name is Leah, and I have a 21-month-old baby boy. His name is Casey.
And she's working and she's struggling like the rest of us.
Yeah.
So let's talk about positive parenting. So Claire, my understanding of positive parenting is using your attention basically as the main goal for your children. So it's kind of like understanding that whatever you give attention to, your child will continue to do. Do you agree with that?
Yes. So you have a great power of attention, and your child will respond to your attention. Whatever you give attention to, that behavior will increase. So what positive parenting is you want to try to increase the positive interactions with your child while decreasing the negative interactions with your child.
Awesome. So let's give an example, Claire. Example, your child is having a meltdown because they're overtired, or not, that's not a good example, forgive me, because they want a specific something, right? What would you do in that situation?
So I think we have two options in that situation. The first option would be to ignore the behavior because, right, we don't want to give attention to any behaviors that we want to continue. So just ignore it very neutrally. Another option that we can do is we can count the behavior. And this topic is actually addressed in the book 1, 2, 3 Magic, which I highly recommend. And you can count the behavior. And then if you get to 3, the child goes in for a timeout.
Gotcha. And if you do a timeout, make it a very short timeout, like 1 to 2 minutes, mom and dad, and don't make it anything long, and make sure they understand this timeout is a consequence and that is not forever, right?
Yeah, so you want to actually, before implementing this, you want to have a discussion with your child when everything is calm, when there has been no negative behavior, and tell them what a timeout is and how you may start to implement a timeout. And then you want to do it for about 1 minute per age of child, up to 5 minutes.
So, Claire, what do you think is the right age to start doing timeouts? Is it like 1, 2, 3? What do you
2 years old is a good time.
what is it, two?
18 months, but 2 years old is a very good time.
Yeah, yep. And that's when they kind of start to understand it. So if you have a 1 year old, that's not what you want to start doing. So basically, if your child is doing something positive, you reinforce it. And if they're doing something negative, you ignore it. And I
Yeah.
know that's hard if you're on the phone, especially with work. I understand that. So, Claire, tell us a little bit about how parents can kind of handle positive versus negative behaviors, especially during the workday.
So if you have a child that tends to nag you when you're on your phone, like my 4-year-old does, you can, before you get on the phone, you can set up an expectation. So you say, Mommy's going to be on the phone for a couple of minutes. I want you to play quietly with your fun bag, which you can keep a bag of toys that your child really likes to play with. So they're going to be very engaged. And then when you're on your phone, kind of shoot them a good look, a smile, good job. And then after you're done, praise them and say what a good job they did.
Awesome. Yep, that's great. So you're reinforcing the positive behavior. What about if they start nagging while you're on the phone? What would you do? That's a really tough one, by the way. I'm sorry to put you on the spot.
Yes. So if you can ignore the behavior, you can ignore the behavior. Also, children know that when you're on the phone that you can't really speak to them, and sometimes they can capitalize on that. But what you can do is you can hold up a finger for counting. So you say 1, 2, 3, and then they're up for a timeout. So they know that you still have the power to cause a timeout, to give them a timeout, even when you're on the phone. And sometimes if the child is behaving in a way that you just cannot control like that, you might have to say to the person that you're talking to, give me a minute, I just need to take care of my child. And then you bring them up to the timeout and then you resume the conversation.
Right, right. So we want to kind of stress the idea that the most important part of positive parenting is your relationship with your child. So the goal is to really have a super strong relationship with your child through spending time together alone, focused only on your child. So give them 5 minutes, maybe maximum 10 minutes at a time. 10 minutes a day will make a big difference. If you focus only on your child, there's no phone in your hand, there's no computer around, and the child leads the playtime. And that you can label that. You can say that this is, Leah's time, for example, right? This is Leah time. No one will interrupt us. And then she will learn to look forward to it. And you can use that as a reward for good behavior, having Leah's time or whatever you want to call that time. So I think that that's a really important thing to say, that if you give them uninterrupted time, that is their goal, that is their reward, and that will,
Yes.
make them happier and make them more likely to behave in an acceptable way.
So I think what you're touching on is it's called feeding the meter.
Okay.
Kids need a certain amount of attention each day, and they want it. They want the positive, but if they can't get the positive, they're going to get the negative. And so what I call the three P's. I don't know, but it's you want to praise, paraphrase, and point out specifically. So this is a technique that when you're spending those 3 to 5 minutes devoted attention with your child, that can be a super refill on that meter. They feel like you care about what they're doing and that you are putting all of your attention into that time with them. And don't worry about making it be too long, because it's really a quality over quantity thing. Many parents have noted significant improvement in their behavior just by doing 3 to 5 minutes a day of this focused attention.
That is awesome. So, Claire, what about setting routines, and how else would you handle discipline besides um, doing the timeouts?
So routines are very good because children don't like to be surprised by anything. And definitely if they're kind of in the groove of playing and you say, okay, time for a bath, they're gonna say, I don't want to. So you can give the expectation daily of the things that you do. And then also you can tell them, okay, in 10 minutes, we're going to take a bath, so that they have time to process and that they're okay with taking that bath or going to bed when it's time to do that.
Awesome. Yep, that's really great.
Yes.
So I know that timeout is one way to discipline children, but another way is to take things away
Yes.
from your child if you have an older child. But in my experience, a lot of parents have been taking things away for like a day or a week. Now, to take away a child's phone for a week, or iPad or whatever you want to take away, that's a really long period of time. What do you suggest, Claire?
Yeah, so if you take that phone or TV away for the week, then you can't take it away again for the rest of the week. So you want to kind of have that ability to take things away for a short amount of time, and then the child gets it back. And then if a negative behavior occurs, you can take it away again. So you can take it away for maybe 15 to 30 minutes at a time, and then they get that back. And you can kind of group those things into rights and privileges. So a privilege is watching TV. So you can take a privilege away.
Gotcha, gotcha. These are such good pointers, and we have lots more to share with you, but we don't want to take up all day. So I think the message both Claire and I want to give today is, at Progressive Pediatrics, we talk a lot about parenting and a lot about behavior during every well visit. So a well visit is really important for your children to stay healthy, and actually for you a little bit to talk to us about other things that are happening in your lives right now. And we always ask how things are going. Let's discuss, what are you struggling with. So I want you to know that we're there for you 7 days a week in Union City and 5 days a week in Bayonne. Claire and I are there, and so is the rest of the team, to help take care of the children. So positive parenting, just to leave you on a positive point, is actually going to help you improve your lifestyle and your relationship with your children. And if some of these techniques are helpful, great. If they're not helpful, we have other resources. We can help you find a good behavioralist or any mental health things that you may need for the children. So we hope you have a great day. Anything you want to add at the end, Claire?
Well, I wanted to let you guys know that the book 123 Magic also has a website that's interactive. And if you don't have time to read a whole book right now, 123 Magic, the website has really good tips, practical tips that you can apply right now.
That is awesome. Have a great day and a great weekend, everybody. Talk to you soon.
Take care,
Bye-bye.
guys. Bye.